presenter is Derek Rogsikin, and he is a licensed mental health counselor at our agency. He also works as a coordinator in our Rio Arriba and northern counties of New Mexico. And he is one of our co-facilitators for our peer support group.
Today, we're going to be discussing first mental health and what that means according to a model developed by an American psychologist, as well as what it means to you. And then we'll be moving on to talk about mental illness. We'll start with the term functional impairment, and I'll explain what that means in a little while, as well as the ACEs survey, which deals with childhood trauma and the effects of that throughout life. We'll also be talking, of course, about children's mental health, some common symptoms and diagnoses that children may have, as well as supports, both for yourself and for children. So the first question that I would put out is, what do you think of when you hear the phrase mental health? What comes to mind about someone who is mentally healthy? In order to talk about mental illness, we felt that it was important to first talk about mental health. And there has been some significant work done by an American psychologist named Martin Seligman on the topic of positive psychology and what those things are that contribute to mental health and well-being. And what he came up with was this model, which is called the PERMA model. And PERMA is an acronym that helps us remember these 5 categories of things that contribute to well-being. The first one is P, for positive emotion, and then E for engagement, R for relationships, M for meaning, and A for accomplishment. So what the psychologist found when he studied happiness and well-being in people was that these 5 categories were strongly correlated to people feeling happy, feeling well in their lives. So the first one is positive emotion. Now this is an interesting one because we need to be able to access positive emotions and we need to experience positive emotions to be happy. So we need joy, we need gratitude, we need connectedness. These are things that contribute to our overall well-being, and the ability to feel these things correlates directly with our feeling of wellness. The next one is engagement. So this will look different depending on what age you are. If you're a child, engagement is playing with your friends, going out, digging for worms, or doing whatever it is that interests you. As an adult, oftentimes it relates to our role identity. Am I a professional? Am I a grandparent? Am I a parent? Or what is my role? What do I engage with? Am I part of a church community or a religious community? Am I doing things? Am I volunteering in the community? So the next one, R, speaks to our relationships. I think it probably shouldn't come as a surprise to most of us that the relationships in our lives and the quality of those relationships has a direct effect on our well-being. Right? The more we have positive quality relationships, the more it strengthens our sense of well-being in our life. And this is true, of course, no matter what age we are. The M again stands for meaning. So this is especially something, this is something that carries with us throughout our life. It's especially true in our childhood. Children are aware of whether they matter. Do they mean something to you? Does it matter that they're around? And of course, in our adulthood as well, this is very important. We want to have a sense of meaning, but it changes a little bit from childhood to adulthood. In childhood, you're looking to the adults in your environment for that question. In adulthood, sometimes we're looking at what's our meaning in life? What am I doing here? What's my purpose on this earth? The meaning starts to change, although meaning to others continues to be important as well. The final letter in the PERMA model is accomplishment. As much as it matters that we do things, as much as it matters that we're on the team, so to speak, that we're playing this could be a metaphor, it could be an actual team that you're on. So it matters that you're on the team. It matters that your players, your fellow teammates like you. And it matters that you do well. Everyone wants to have a sense of accomplishment, that the things that I'm spending my time doing in life are turning out well, that I'm adding value to the things that I'm doing and I'm succeeding. It's another major correlate with our well-being. So these are sort of ways, it's a way for you to kind of take a look at your situation or the situation of another person and say, how am I doing in each of these departments? And is there any changes that I could make to strengthen these things in my life? If you're feeling like something's lacking. So first we talked about mental health, and now we are talking about mental illness, right? So what is mental illness? What is the difference between feeling blue or feeling nervous and being diagnosed with depression or anxiety? Right? Well, we come back to this term functional impairment. And this is how clinically we determine whether something is just within the normal range of what we should be experiencing, happiness, sadness, joy and loss, or is it something that can be diagnosed? Well, functional impairment refers to whether it actually stops you from doing the things that you would do in your life. Is what you're experiencing a barrier to you living the life that you want to live or not? This is a major way that we as clinicians can determine whether a clinical treatment might be available or whether something lower level, just like a community support type of intervention might be better. So again, this is a very important distinction. Is it interfering with your life in a significant way or not? That is one way to determine whether something falls under the range of mental illness. So here's some of the most commonly diagnosed disorders that we see in children. So ADHD, of course, it's a very popular one. We hear about it quite a bit. Interestingly, it's also easy to misdiagnose because there are a number of other things that can be going on with the child that can appear similar to ADHD, including being a child, by the way. Very young children present with most of the symptoms of ADHD. Behavior problems, anxiety, and depression are the top 4 diagnoses in youth. So here we have a chart. This is an interesting one because it shows at what ages these behaviors tend to show up. Right? As we can see pretty clearly, ages 3 through 5 is not the time that we're often seeing these diagnoses. But part of the reason also may be that at that age, it's very difficult to diagnose in the early years. Between 6 and 11, you'll see that these will start to rise. Ages 6 and 11. It's interesting to note that behavior disorders are actually the most prevalent between the ages of 6 and 11. So if any of you have children between the ages of 6 and 11, and you've seen this, you're not alone in that. And of course, in the teen years, these things continue to rise for the most part. And it's because teens become more expressive and they have the ability to articulate themselves better. It's also easier to diagnose at this time. So beginning with ADD and ADHD, so almost 10% of children between 2 and 17 have received a diagnosis for this. It's extremely prevalent. But I think it's important, again, to talk about the difference between what's developmentally appropriate for a child and what is actually clinically diagnosable as ADHD, right? So I would like you to just briefly take a look at this infographic and tell me whether this sounds like a preschooler to you or not. This is one of the reasons I think why it's difficult to diagnose in very young children is because we have what is developmentally appropriate attention deficit in young people. And then we have these persistent symptoms, things that in spite of attempts to work with and support the child around them, you don't see a change over time and over the development of their lifespan. So any number of these symptoms can be correlated with ADHD, and they also may not be. So we would also like to say that this is just meant to be, these infographics that we're about to share in this presentation are meant to be a guideline for your understanding, but don't read this list and take it to mean that you or your child has ADHD. We strongly suggest that if you have concerns that you get in to a qualified clinical professional and have an assessment done. And that would just mean asking for a referral for counseling, which you can do through our agency as well. So generalized anxiety disorder, one of the other top 4 diagnosed mental illnesses. Another infographic on some of the symptoms. Restlessness, fatigue, excessive anxiety, increased muscle soreness, which is one I think a lot of people don't recognize. That muscle soreness can actually be a symptom of anxiety. Impaired concentration, inability to focus, irritability, and difficulty sleeping. So again, another guideline, if these are things that you notice in yourself or your child and you're concerned, a good time to maybe set up an appointment for yourself. So depression shows up differently in some ways in children than it does in adults, and in certain ways that you may not expect, and some that you also may. So in children, they will exhibit a decreased interest in their favorite activities. They'll stop doing the things that they used to love, right? They'll have difficulty keeping friendships, social relationships, and those bonds. They'll have an extreme sensitivity to rejection or failure. You know, the kids who just can't lose at a game, the kids who, won't do things for fear of, of failing. That can be part of it. Frequent absences from school, and also a sharp drop in grades can be warning signs. Again, with depression, physical symptoms with no medical cause. Very often in schools, we see kids saying, my stomach hurts, or my leg hurts, or something that the doctor couldn't diagnose could be related to depression as well. Some of the more well-known symptoms: frequent sadness, tearfulness, or just crying easily, hopelessness, being low energy or tired feeling all the time, having low self-esteem or increased irritability. And this is one I think people often don't catch. If they're more irritable, if they're more edgy, if they're just a little more kind of mean seeming, that can be a symptom of depression. So also increased frequency of tantrums, changes in eating or sleeping patterns, if they're obsessively worrying about something or afraid of something, being isolated, or even talking about or attempting to run away. I think very often people don't interpret that last one as a sign of depression, but it absolutely can be. And lastly, thoughts or expressions of suicide or self-harming behavior. Absolutely something that you want to take seriously. I think that we never want to downplay when a child says something like this, because inevitably they're communicating something about the reality that we want to take seriously. And then the last one, trouble concentrating. What you'll notice is difficulty concentrating showed up in ADHD, in anxiety, and in depression. And that's why it's important to get the opinion of a professional in determining a diagnosis. Teenagers exhibit depression yet even differently than younger children or adults sometimes. You'll see they lose interest in topics. They will increase risk-taking behaviors. So if you have one of those teens that all of a sudden just wants to do, and again, there's developmentally appropriate risk-taking for teenagers, and there's extreme behavior, and it's important to know the difference. And if you are concerned, again, of course, set up an appointment for yourself. So excessive or inappropriate feelings of guilt, and if they're just wrapped by guilt and they can't get past it. If they feel worthlessness or self-hatred, if they delve into excessive substance use, if they seem short-tempered. Very often in boys, it's not so socially acceptable to show sadness. And so short-temperedness and anger will often be how teenage boys express depression. Also, difficulty making decisions can be a symptom of depression in teenagers. There are a lot of phase of life changes that can be triggers. And they're not always, because everyone's nervous system is different. But some teens can react strongly to some of these things. Starting school or changing to a new school, having conflict in the home or within the family, in-person or social media bullying, of course, has a profound effect. Medical issues, parental separation or divorce, or even loss of other family members from the home, changes in the home structure. Family stressors, of course, financial instability. The way that children and teens will express these things behaviorally are thus anger, defiance, aggression, very typical behavioral issues that you might see in children at home or in school. They might show depressive symptoms. They might just seem visibly depressed and withdrawn. It's the sort of hoodie up, no talking type of demeanor. substance using again, and again, issues with school can also be behaviors, stay at school, refusing to do homework, etc. So this slide speaks to the reality of the inner world of a child. This is by Dr. Karen Purvis. It says, put aside your preconceived expectations about your child's behavior relative to his or her age. At risk, adopted children may appear to be a certain age physically, but inside they are playing catch up emotionally, behaviorally, and developmentally. And so what she's saying is that children have multiple ages at one time. They have a chronological age, but their social age may not match with that chronological age. Their intellectual age may not line up with the age they are on paper. Their emotional age may not line up. And all of these things are formed by and informed by our experiences in life. And so sometimes when you see an 8-year-old or a 12-year-old or a 17-year-old in front of you, that is not necessarily how they feel or experience the world. And due to their experiences, they may be trying just to catch up to what you expect them to be. And so, of course, very important to be patient with children in this process when you see something that doesn't look congruent. So a very important topic that we want to include in this presentation is, of course, caregiver mental health. And that speaks to your mental health and the mental health of anyone else who's helping you in raising this child or these children. So the question asks, how has your role changed since you became a caregiver? What has become different in your life since you made this decision? We want to acknowledge that kinship guardians have so much on their shoulders. You carry so much on your shoulders in taking on this responsibility. Some of the common issues that kinship guardians like yourself may be facing are grief and loss, isolation from your peers and your social life, changes in routine, financial impact, changes in plans that you may have made for your life and your life planning, changes in boundaries and relationships, where once you were maybe grandma, grandpa, or aunt and uncle, now you've become mom and dad. Guilt and embarrassment, the way that friends or family may react to your decision, transference and projection. I think that this refers to seeing your emotions in other people, putting your emotions upon other people, or putting yourself in the shoes of others, sort of more than is healthy sometimes. Split loyalties. Sometimes these decisions divide families. They create conflict. Anger and resentment can come up. And also just the life stages, the realities of going through the stages of life and how your needs change as a caregiver, as a human being. So we wanted you just to take a moment in this presentation, check in with yourself in this journey that you're on right now. How are you feeling? How are you doing with this? We just want you to pause a moment checking with yourself and be honest. It's important to know where we are, and it's also important that we have our toolkit of ways to cope when it gets tough. Some coping techniques that were developed by researchers in this field, in the field of ancient caregiving, were to prioritize. Choose the things that are really important. Don't try to do everything at once. It's not possible. Just do what you can do realistically with your day. And on that same note, don't just take one day at a time. Take one thing at a time. It's not that we have to get to school. You need to be thinking about what time you have to arrive at school. Think about tying those shoes first, and then get to the next step. If you thin slice it, it makes it more manageable for you. And you don't have to worry about all of it at once. Also, be sure to take time for yourself. Take time that's just for you. Whether that means having a distinct, strict bedtime for the children, or having a time that you and your partner can get out just to be alone for an hour. Make that a priority. They also say make life easy. When it's possible, you don't have to cook an elaborate dinner every night. You don't have to make every meal from scratch. TV dinners are fine. Absolutely fine. Also, picking up something cheap out, getting food from fast food or whatever it is absolutely fine. As long as everyone's safe and nourished, don't make it hard on yourself, right? Also, set limits with your children. Extremely important that you have those limits. Again, a strict bedtime, so you can have that critical you time at the end of the day. So you can watch your favorite show or just spend some time with the other adults in your family. All right. Ask for help. So important. When life feels impossible, that's the time you ask for help. That's how you know. When it's more than you can do, you have to ask for help because you can't do more than you can do. Right? Join a support group. And while I'm on the subject, I'd like to remind you that we have a support group through the Fostering Family Program that's online, so you can join from anywhere every first and third Monday of the month. And if you're interested, please let us know in the chat, and we'll be happy to connect you with that. One of the other tips was to consider your religious community. If you're a part of a religious community, that can be a tremendous source of connectedness and support. A lot of those things that we talked about in the PERMA model, you can get through your engagement with your religious community. It can be a very powerful thing. Make clear emergency plans. And this one is really important. You do not want to be caught off guard if something were to go wrong. If you're aware that there are some things that could go wrong, if you're aware that there's a situation that could arise, it's very important to have a plan for that. And not only that, but to consider, of course, we hope for the best, but we prepare for the worst. So consider what could happen and have a plan for that, because you don't want to be caught off guard in a moment of extreme need for yourself, for your family. Also, let yourself off the hook. This is so important. It's so easy to put so much pressure on ourselves to be the perfect caregiver, to do it all. But sometimes you won't, and you've got to forgive yourself. It is not realistic that we will do everything perfectly all the time. And so be realistic with yourself and let yourself off the hook for the things that you haven't been able to do. You just have today. to try to come back better. So now we are going to talk about supports and where you can find those supports for yourself and your family. The first level of this is informal supports. And this refers to supports that are not professional agencies or organizations, but based in your community and your family. So the first level of that is your family and your friends, right? Your family and your friends can be a tremendous source of support to you. And this is sort of the first level of our support network. And we have in our religious or our social groups, if you're part of any kind of a group, whether it's religious or not, whether you have a common interest, whether you go work out at the gym with your guy or girlfriends, that again can be a very strong support in our lives. And then support groups. These do not have to be formal. They can be you and other people who are running them yourselves. And these are just so that you are not alone in your experience. The next level of this is formal supports. And these are the organizational or professional level supports that you can connect with. Fostering family is one of those. And please do remember us if you find yourself needing any support related to you or the care of the child or children in your life. Along with that, our parent agency, Southwest Family Guidance Center, is a behavioral health agency. And if you have any clinical needs, such as those that we've discussed in this presentation, we would encourage you to reach out to us for support. Also, all of the other wonderful behavioral health agencies in our state, they're all working for you, to support you and your family. And we encourage you to reach out wherever you feel is appropriate and comfortable. There are also state level assistance programs. And if you would like to call and speak to one of our coaches about what some of these are, there are so many programs across the state that are there to help people in your position. And sometimes all we need to do is know about them. And then we can start to receive that support that makes life just a little more livable. So we encourage you to reach out to our program if you need further information on some of these state level assistance programs. Also, we have the New Mexico Behavioral Crisis Hotline, and this is a number that we want everyone to know about. This is the phone number that you call when you are not sure what to do. It's not exactly a police situation. It's not exactly a medical situation, but there's a crisis. And you need to speak to someone to help you organize what to do next. This is the hotline for that. We hope all of you would just program this number into your phones. Every caregiver, everyone who works with any situation where there could be risk should have this number. And I would say maybe just everyone in general should have this number. So please save this number, please.
Just tagging on that, just to let you know too, this number is operated by a licensed clinician. So you're actually speaking to somebody who's a therapist or a social worker who's trained to deal with behavioral crisis lines, and it is available 24/7.
Thank you, Robin. Yes. So you know you will be speaking with a professional. Also, again, a quick plug for the support group that I mentioned earlier. Our English language support group happens every first and third Wednesdays from 6 to 7 p.m. And again, that's a Zoom link, so everyone is invited and welcome to join. And also we have our Spanish language support group every second Thursday of the month from 5 to 6 p.m. And if you would like more information on that, you can contact our supervisor, our program, Leandra Romero, and her email address is indicated on the screen there.
The goal of our program, the goal of our agency, is really to be able to look at, to really be helping support you caregivers, supporting families in terms of creating wholehearted wellness. So I just thought this was such a good fit. I would like to share this, the Wholehearted Parenting Manifesto with you. It's by Brene Brown. Above all else, I want you to know that you are loved and lovable. You will learn this from my words and actions. The lessons on love are in how I treat you and how I treat myself. I want to engage with the world. I want you to engage with the world from a place of worthiness. You will learn that you are worthy of love, belonging, and joy every time you see me practice self-compassion and embrace my own imperfections. We will practice courage in our family by showing up, letting ourselves be seen, and honoring vulnerability. We will share our stories of struggle and strength. There will always be room in our home for both. We will teach you compassion by practicing compassion with ourselves first, then with each other. We will set and respect boundaries. We will honor hard work, hope, and perseverance. Rest and play will be family values as well as family practices. You will learn accountability and respect by watching me make mistakes and make amends, and by watching how I ask for what I need and talk about how I feel. I want you to know joy, so together we will practice gratitude. I want you to feel joy, so together we will learn how to be vulnerable. When uncertainty and scarcity visit, you will be able to draw from the spirit that is part of our everyday life. Together we will cry and face fear and grief. I will want to take away your pain, but instead I will sit with you and teach you how to feel it. We will laugh and sing and dance and create. We will always have permission to be ourselves with each other. No matter what, you will always belong here. As you begin your wholehearted journey, the greatest gift that I can give you is to live and love with my whole heart and to dare greatly. I will not teach or love or show you anything perfectly, but I will let you see me, and I will always hold sacred the gift of seeing you, truly, deeply seeing you.